This is the October meeting for the Jackson County Local Public Safety Coordinating Council meeting. My name is Eric Geyer. I'm the Director of Community Justice for Jackson County, and I also chair this meeting. So we're very fortunate today to have a number of guests from out of town. So today our subject is going to be Measure 110, some of the progress, some of the promise, and then also some of the challenges that we're meeting. I think that this is an important forum for that discussion as we transition some of the substance use disorder response from the criminal justice system to be more of a health and systems-wide concern. And within that comes a lot of promise, and it also comes a lot of responsibility. Ron Williams and Tera Hurst from the Health Justice Recovery Alliance, who will be speaking first. And William Nuneman is here also from Lines for Life. Thank you so much for joining us. I'd like to turn the floor over to Ron and your group. Ron, you reached out, I think about 3 months ago, offering to make this presentation. And I think you've made it to a few other counties statewide. And thank you for your patience. And thank you for bringing your team to join us today.
Thank you so much, Eric. I really appreciate your help in getting this set up. And like you said, we are doing as many local public safety coordinating council meetings as possible. We've gotten to many, and we have many more to go. Thank you to Jasmine as well for the logistics of setting this up. My name is Ron Williams. I'm a person in long-term recovery, which I define as being alcohol and drug-free for going on 22 years. And along with me today are Tera Hurst and Billy. Tera Hurst, she's the executive director of Health Justice Recovery Alliance, and we also have Billy Nuneman of Lines for Life, and we're going to walk through a presentation here. They'll introduce themselves as we go along. So I'm going to share my screen now, and Tara's going to begin.
I can start with saying hi. Tera Hurst, I'm the executive director, as Ron said, for Health Justice Recovery Alliance. I'm also a person in long-term recovery, and we're excited to be in front of you all and just open up. What we've been doing is going through this kind of semi-brief presentation and then just really having a honest and open conversation about the challenges that folks are facing, as well as ways that we can improve. So we're talking about Measure 110, which is now Senate Bill 755. The Health Justice Recovery Alliance is an organization that was really brought together once Measure 110 passed, and it's our mission to implement the measure as the voters intended. So our main values and mission is to ensure that we are moving substance use from a criminal justice system to the healthcare system, which is something that Eric said, as well as really focus on the communities that were most impacted by the war on drugs. And I don't know if you can do the next slide, Ron. Gives you a little bit of an idea. This isn't all the organizations that are part of our alliance, but this is a handful of them. We have over 75 community organizations. They're statewide, and we also meet with small community-based providers as well as larger community-based providers weekly to really work through policy implications and policy questions as we move forward. So this is a little bit of a kind of showing the timeline of Measure 110. I think we can all agree that it was a quick ramp up after it passed. And some of that was intentional and I think helpful in some ways. And it's also created some issues as we're all trying to get used to and adjust to the new system. So we all know that the voters approved it in November. In February, decriminalization went into effect. Lines for Life and Billy will talk more about the hotline that was established in February 1, as well as the Oversight and Accountability Council, which is the council overseeing the rulemaking and the grant making for Measure 110. And Ron is also one of the tri-chairs for the Oversight and Accountability Council, and he can talk a little bit more about that. One of the things that we found, and we'll talk in greater detail, and I know Jackson County providers did receive some funds. One of the things that as we started talking to folks when we first got started what we heard overwhelmingly was the concern that due to COVID and due to lack of funding, there were some really critical providers that were going to have to close their door because they just didn't have access to funds. So we worked with the legislature and pushed for early release of funds from Measure 110 to fund the services that Measure 110 was intended to fund, which resulted at the end of the day of $33 million being invested in harm reduction and recovery services in this past legislative session. We are now in the temporary rules were passed for the behavioral health resource networks in September. If you haven't gotten a look at that, that's a really good document to take a look at because they're still accepting public comments for the next couple months. And then we have a RFGP that's coming out at the end of this month for the burns, which is about $300 million to be invested in Measure 110 services over the next now until June 2023. And then the burns, which we will go into more detail, which is the behavioral health resource networks, will be established by January 1-ish.
The only thing I would add to that is that the simultaneously with the burn RFGP, the behavioral health resource network RFGP, simultaneously the Oversight and Accountability Council is working on the permanent rulemaking process.
Yes, and we have our Rules Advisory Committee happening in this week. So I think, Billy, you're next.
Hello, everybody. My name is Billy Nuneman, and I am the Addictions Recovery Program Supervisor at Lines for Life. I am also a person in long-term recovery, and I thank you for your hospitality today. So with the law going into effect on February 1, Lines for Life was contracted as a, and the statewide phone system was contracted as a temporary stopgap, so that as people are being cited while the burns are getting funded and up and running, people who are cited can still participate in a screening and get their fine waived and get connected to resources if that is something that they are interested in. OJD and OHA requested that we come up with materials for law enforcement, since this was going to be the primary in this first phase way to let people know about the program. So what we came up with was a palm card, which you see on your screen in front of you, and based upon lists from OJD, we printed up 25,000 of these palm cards and distributed them throughout the state for law enforcement. So what we are looking at and hoping for is, as people are cited, they're given this palm card. It has them, it tells them everything they need to do to get the fine waived. They call us. We'll do an initial triage and assess for safety or any acute needs. And then we will run through a screening process for the individual. We have been using an SBIRT, which is a screening, brief intervention, referral to treatment screening tool. And in particular, we're using a DAST, which is a drug abuse screening tool. That allows our call takers, who are a mixture of CADCs, peer support specialists, certified recovery mentors, to walk through like a series of yes and no questions with the individual about their history with drug use, and then also expand that into any other issues or needs that they have. We, in particular, focus on, housing, employment, if there's any health-related issues. When we are talking to people, we try to connect them to peer services or harm reduction services in their area, if they're interested in that. And then when they finish, we send a verification letter to them, which they then present at their next court date, and they have their fine waived. As we're talking to people, and if they want resources, we will offer follow-up calls to see if they're able to connect with those resources, or if they would like to work with us in an ongoing case management position, where the call taker will just be a support for the person. We've had people that we've connected to before and after their court dates, and it's just a matter of trying to keep that connection going with people. And then I think the next slide, Ron. Yeah. I don't know if you all want to talk about this stuff.
Are you going? You're just going to skip the whole bill?
I appreciate you guys being, really time conscious, but at the same time, it might be very helpful. So thank you. If you don't have, if you have a minute. Okay, thanks.
We won't skip the bill. Ron sometimes gets a little ahead of himself, clearly. So as some of you may know, during the legislative session, the Senate Judiciary Committee expanded its scope for the session, and it was the Senate Judiciary and Ballot Measure 110 Implementation Committee, where we took up, putting 110 into law, or into a different way into statute, and really answering and filling in gaps and holes. So Senator Przanski pulled together a legislative work group with all the stakeholders in the virtual room, and we worked, I think it was 6 hours, some of us met for 6 hours a week, hashing out every single detail, and really having robust and important conversations. And you can imagine that not all of us agreed all the time. We had everyone from providers to the district attorneys to public defenders to cities, counties, law enforcement, sheriffs, kind of all of the different stakeholders that touch Measure 110 and now Senate Bill 755. And so we wanted to just go over some of the highlights of what Senate Bill 755 does and did, since, ballot measures are not always a perfect instrument and they leave a lot of details out, and that's intentional. But this is kind of how we see that Senate Bill 755 was not just clarified, but also strengthened. So the biggest one, which we're all in the middle of right now, is establishing behavioral health resource networks. If some of you remember in Measure 110, we were supposed to have addiction recovery centers in every CCO region, which is about 13 regions across the state. And really, we all agreed at the table that it wouldn't serve communities in the best way possible. So we agreed on counties, and we also wanted to make sure that this was really about, it didn't silo the system even more by just focusing on addictions and substance use, but if there is a co-occurring disorder, that would also be welcomed in this network. So we called it the Behavioral Health Resource Network. And basically what it means is that in every county, and that's not by county government, but really if you can think of it as more as the geographical boundary, there needs to be a network that consists of housing, which is transitional, recovery, and supportive housing options. There needs to be harm reduction services available. There needs to be peer support services available, and low barrier access to treatment. And that can either be one organization that offers all that. That could be 5 organizations. That could be 15 organizations. It really depends on the county. It depends on who the providers are and how they want to interact with each other. But there is about, when all is said and done, probably about $270 million that can go to establishing and setting these up. And the RFGP, the request for grant proposal, will be out this week. At least that's the hope. It's been stuck in a little bit of the bureaucratic slowdown. And so our hope is it'll be out this week, and there'll be about 4 weeks to apply. And what we're really asking in any meeting that we're in is that if you do know providers that would be a good fit for this, please encourage them to apply. And our organization is also helping, if they're small community-based organizations, to provide them with grant writing support and other support to make sure that we're really getting a diverse group of providers at the table. So that's the first thing that it did. The second was really making sure that the Oversight and Accountability Council was going to prioritize funding organizations serving the communities most impacted by the war on drugs. It also added language to recognize the 9 federally recognized tribes and tribal affiliated organizations. Ballot measure had left that out. This was to make sure that tribes recognized that they were in and were able to secure funding.
And I just wanted to add that the Oversight and Accountability Council has made a set aside for the tribes of 4% of the total burn funding.
Thanks, Ron. That's right. You want, so then another one that we heard pretty loud and clear from everybody, I think we were all concerned, is what happens with youth in this process. It was silent, the measure was silent on youth, and actually Molly Rogers from Wasco County created a whole different table because we all love our tables for youth, and it was a youth work group, and we kind of grappled with the issues around Measure 110 and how do we, especially when there was a Senate bill being passed that would waive fines for youth in general, how do we incentivize and ensure that youth have access to these services? So they will be referred to the juvenile system instead of going to the adult system, and they will also be able to enter into formal agreements to work through services. Another big component that we really need your all's help on is making sure that our law enforcement provides the information on how to get a screening, and that is going to change. It will be Lines for Life will still have their line up, but hopefully the burn and the local behavioral health resource network will also be a place for law enforcement to be able to refer folks to get a screening and to get connected to services. And this is ramping up, but it's not necessarily available at this moment. And then there's a really strong audit section in the Secretary of State has to oversee. I think the first one comes out in 2024. There's a lot of important metrics in there on what they need to look at and evaluate. There's also separately this isn't about the law, but the OHA has pulled together a pretty robust group, stakeholder group, where we are looking at the evaluation and the measurements and the metrics of what data do we need to collect? What are we missing? What do we have access to make sure that we're really tracking what's happening on the ground and if it's working or not. And so here's the citations at a glance. This is from the Judicial Department. It's a little bit older. We can send along the newer one. The latest numbers, I think, are from September 30th. And it's an additional, 50 or 90 cases. This just goes by county, kind of where your county's at. So Jackson County has handed out 25 citations, and you can kind of see it runs the gamut across the state.
This section here just kind of refers back to the timeline that that shows that in April and May, the Oversight and Accountability Council did an RFGP specifically for access to care grants in order to get money out into the community right away so that folks could get the services that are promised by Measure 110. There was an overwhelming response statewide to the RFGP. There was over 115 requests for funding. The total request was over $40 million. The Oversight and Accountability Council, through a lot of advocacy that started with HJRA and our partners, the HJRA had convened policy tables that kind of mirrored what was happening on the Senate committee. There was like we had a main steering committee that consisted of a number of primarily people of color organizations, Latino Network, Coalitions of Communities of Color, NAACP, Native American Youth and Family Services, and others were a part of that steering committee. We had a criminal justice policy table that consisted of the ACLU, Partnership for Safety and Justice, and others. And health services policy table, it had a number of recovery service providers and treatment providers, Central City Concern, Outside In, Bridges to Change, Miracles Club, and a number of other organizations that participated in our policy table that informed us about the urgent need to get funding out into the community. And so in kind of two separate chunks, first through a speaker's note, and then second through a budget note, we were able to do advocacy that resulted in about $30 million being invested. 70 organizations were funded around the state, or funding went to organizations in 26 different counties. As you see, some of those counties were rural, southern, central, eastern, and so on. It wasn't just metro. 33 organizations increased access to treatment for the indigent and uninsured. 52 organizations stated that they were hiring new peers and peer support specialists and certified recovery mentors. 32 organizations or service providers added recovery, supportive, or transitional housing. 30 organizations increased harm reduction services. So there was quite a lot has gone out into the community. And one of the things that we're seeing is that there's kind of what we're seeing is that this is not being reported. The number of people who are actually currently receiving services funded with Measure 110 isn't getting reported. We still haven't captured that data. The OAC is working to get there, along with the stakeholder evaluation group and with OHA. And these numbers and the number of folks and the programs that are actually engaging in performing Measure 110 services, will be able, hopefully, to have those numbers by the end of this year, if not sooner. So here are just some headlines from around the state. You can see that the Rogue Valley nonprofits got money from through Measure 110. Eugene, these are just some headlines that we were able to capture that show the investment happening all over the state. Some additional headlines here, and which brings us to kind of where we're at with the investment currently.
So we talked a lot about this already, but it's about $300 million. And just of note, our understanding is that moving forward, it's going to be closer to about $250 million a biennium going into these services, but due to an opioid settlement that went into the fund, as well as some funds that rolled over from last biennium into this account, this is where we're at now. And this really is 5 times more than Oregon spends on non-Medicaid funding for these services, which is why you know, our work and our teams really feel energized by the amount of money that's going into a system that has not necessarily seen these types of investments. And even though we are transitioning from one system to another, we are investing in some life-saving, critical, evidence-based and evidence-informed services over the next 1.5 to 2 years. And so then we talked about this. The only one we didn't talk about is the system-wide assessment. This is something that Representative Tana Sanchez was advocating for, not just last session, actually the session before as well, was to really take a look at what is, where are we at in Oregon, what services are available, where are the gaps, and what, you know, what do we need to be doing? Our understanding, and maybe Tony will be able to talk about this more, is that the Alcohol Drug Policy Commission and OHSU and the Oregon Health Authority are working on this assessment. Everything is slowed down for multiple reasons. And, you know, my understanding is that it's at least the draft proposals coming out in November, but I could be wrong. And Tony probably knows more than I do about this. Then we know that the RFGP is happening in October. And if we can get it out, if OHA can get it out this week, then that'll still be sticking to that timeline. And that's to invest the $300 million.
All right, and I just wanted to just add, just in terms of the rulemaking process. So the OAC has the role of convening the Rules Advisory Committee. The Rules Advisory Committee is actually going to meet twice this week. And then once that happens, we'll move forward with the permanent rulemaking process, which includes notifying the legislature and Secretary of State of a permanent rule process, doing a public hearing, and then doing a public comment period. So all that stuff is moving forward simultaneously with the Burn RFGP, which the OAC has one more step to do tomorrow, and then that should be out within the next week or so. And then there'll be, as Tara said, about a 4-week period for the proposals for the opportunity to be open, and then it'll close, and then there'll be a 4-week evaluation period. Then a couple of weeks later, we hope to make the notice of awards. The OAC hopes to make a notice of awards.
Ron, quick clarifying question. I just want to make sure I'm keeping up on my acronyms. So RFGP is request for grant proposal.
That's correct.
BHRN is Behavioral Health Resource Network.
That's correct.
Okay, I'm good so far, but OAC is the one that's beyond me right now.
Okay,
So,
that is the Oversight and Accountability Council.
great.
And they're the ones who have the authority and power to create rules and requirements for the behavioral health resource networks and access to care grants. They are in charge of the funding.
Perfect. And I want to thank everybody involved for changing the name to Burn, because when you called it an ARC, we already have the Addictions Recovery Center here in Jackson County. And so our heads were spinning. So this helps ground us a little bit and figure out where we're at.
Yeah, and Lori Paris has been a member of our policy table kind of from the beginning, and that was definitely making her head spin quite a bit. So and she was at those stakeholder meetings as well.
Right. So thank you all very much. So
Thank you.
Thank
Thanks,
you.
everyone.